My name is Josie Muigai, and I focus on health PPPs in Sub-Saharan Africa for IFC, which is part of the World Bank Group. Cancer is one of the non-communicable diseases that is having a major impact in Sub-Saharan Africa. We know that when people are sick, it affects the economy, and in a lot of instances, because there really has not been a focus, we're finding that patients are diagnosed late stage, which a lot of times means that they will be terminal, and that does affect our economy. So my role here at IFC is essentially to focus on health public-private partnerships, and not only just in Kenya but in Sub-Saharan Africa. And what we really look to do is to look for avenues through which we can improve public sector healthcare through the involvement of private sector. So I would look to say here in Kenya, for example, and again it goes back to the infrastructure gap, there is to date one hospital, which is Kenyatta National Hospital, that offers radiotherapy services. A lot of cancers are treated not only using chemotherapy, but about 50% also use radiotherapy. Again, just because of the capacity on the supply side being limited, we essentially have had a very high level of demand with long wait lists. Unfortunately, last year we had a couple of instances where, because of, again, the high utilization of the radiotherapy machines, they were not working for a period of time. During that period, I essentially was part of support to the Ministry of Health, and we were able to reach out to some of the private hospitals that have cancer care in terms of radiotherapy, and they were able to avail their services. Nairobi Hospital to continue to provide services to patients who had been already receiving radiotherapy services, and Aga Khan actually offered to a certain Kenya shilling amount to take on patients who were still on the waiting list. The prioritization was made so that children that were waiting radiotherapy services were prioritized and received the services. So private sector has already stepped in. I think that there is additional opportunity with the NHIF now offering a benefit that is included to beneficiaries for both chemotherapy and radiotherapy services. There is some existing capacity in private radiotherapy centers that can be leveraged by the public rather than have them wait for services at Kenyatta National Hospital, even as we partner with the Ministry of Health to build new infrastructure that will expand the public capacity. So in terms of our engagement with the Ministry of Health, we are an advisor. IFC has both an investment aspect and we have the advisory aspect. So we are essentially what you call a transaction advisor. In order to enter into a public-private partnership, there's a certain mechanism that must be followed, and this is according to the PPP Act and the PPP regulations. And IFC has tremendous experience internationally on advising in PPPs. So here we're advising the Ministry of Health in accordance with the laws in Kenya in terms of, first of all, just doing the due diligence to ensure that the number of facilities and the way that they are rolled out will actually be financially viable, or really what I can translate that in layman's terms as infrastructure that will be scaled out in a way that the government will be able to afford, and that it will really, again, look to diversify where care is provided from Nairobi, which is really the capital city, to different regions, and again that just helps increase access so everybody doesn't necessarily have to come to Nairobi. IFC has supported the NHIF along with other partners to use NHIF as the platform for which to achieve universal health coverage in Kenya. The initial phase of this program was focused on households where they have orphans and vulnerable children, where the government of Kenya would actually pay for the premiums of these families so that they could get onto NHIF. What this translates to is that they can actually now access care without having to pay cash, which can be impoverishing. So as Kenya increases the number of people on health insurance, which increases the pool, it increases access to services, which means that people will seek care sooner versus later. And what's great is that the NHIF package not only is hospital anymore, but it's also the outpatient aspect of it. So on the private sector side, what that translates to is that they're no longer dealing with cash transactions, but they're able to actually deal more with an institution that's an insurer that they are guaranteed payment from. So I think as we increase access to insurance, then there will be more comfort on the private sector side in terms of taking on patients who may or may not pay. So in terms of IFC here in Sub-Saharan Africa, Kenya is the leader in this area. Again, we're working with the Ministry of Health to establish the regional and then the sub-regional cancer care centers. And this provides an example. And I think a lot of times governments are willing, but when it's new territory, it takes a lot longer to actually move and implement. And I think Kenya will provide the example so that we're now able to provide the Kenyan example to other countries. Again, what public-private partnerships do is where governments would not necessarily need to have the money available upfront in order to be able to invest in the infrastructure or in terms of having the number of specialists that you need to be able to run those centers already trained. So private partners can come in and they can help fill that gap. So it takes 3 to 5 years to train a consultant to become a specialist. So in the short term, you're able to bridge the gap by having the private partner also help provide the clinical services. But again, we talked about the educational aspect of it. So as you're using that agreement to also train clinicians, they are then able to then take over, I would say, and continue to provide the services within those facilities. I think the Kenya example will be duplicated in many more countries in Sub-Saharan Africa.